don't know if recording. All right, thank you. So I'm gonna model this presentation, and in between, I may also share some facilitators' notes, so that and also take pauses at any time if folks want to ask questions. Please let me know. I'll try to monitor the chat as well, and then feel free to use the raise hand function. So, a little bit about our organization, and you will substitute this when you present it. You don't have to include the NICOS slide, but we're from NICOS, Chinese Health Coalition in San Francisco. We were founded in 1985 by five of the largest Asian serving health organizations in San Francisco, including NEMS, Chinese Hospital, Onlock, Self-Help for the Elderly. I stands for Independent Physicians Association. Today they go by a different name. I see there's a little bit of misspelling there. It should be Chinese Community Healthcare Association. So I'll modify some of these slides before I send them back out again. And I've been at NICOS a long time. I'm almost there for 2 decades, and I started there with working on the problem gambling project. And this is something that, like I mentioned earlier, very personal to me, and something that I feel strongly about that we need to raise greater awareness within our many Asian communities. NICOS actually did a survey in the late 90s, and we uncovered that gambling was one of the major issues impacting many of our Chinese communities at that time. In our survey, 70% of the people we surveyed said that gambling impacts the people that they know, that it impacts people that they care about. So I'm going to model how we usually start our conversations. We usually start with a brainstorm session. And I see that the answer is already on the slide. But can I ask the audience to maybe give me some of your own personal definitions of gambling? What do you think it means to take a gamble? What does that look like? How does that look like in our different communities? What does that mean to people, do you think? And feel free to use the chat, or if folks want to unmute and say it out loud, perfectly fine. Do folks want to share your own definitions of gambling?
I will start,
Thank you, Chris.
and then hopefully others can chime in, because I know they all have their opinions. Um, to me, it involves typically taking a money you sometimes involve, oftentimes it's money
Mm,
that's involved
mhm.
in which you're going to put something down in hopes that you're going to grow that money, make a
Yeah.
decision on something and you're going to double it or something,
Yes.
without any proven outcome or
Mm.
strategy, really.
Yeah, so often there's no guarantee, like Chris said. Thank you so much, Chris. And I feel like Kevin is kind of along the same lines that it's sometimes seen as a way to make fast money, that you're putting something down and you're hoping to double it or more. Tina mentioned betting, using money, a game of luck. Yeah, so often there's an element of uncertainty, and that you're putting something of value on the line. For a lot of the people we work with, it is money, but sometimes you're also dealing with things like that's not money, right? Sometimes people who are betting on something valuable, like their car, their home, or their shoes or other possessions like jewelry. My stepfather took a lot of jewelry to the pawn shop to, trade for money, thinking that, oh, I'm just borrowing it. Today I'm gonna win and I'll go buy it back, but never being able to recoup all of his losses. What are some types of gambling that you all have seen in your communities? Can y'all just shout out some games that are popular in the chat or unmuting? Like what gambling games is common among the communities that you work in? I see mahjong, poker. Mahjong is your favorite, Tina. Yes. And it can be played just for fun, just for skills with no money. Blackjack, mahjong as well. A lot of MJ. Yes, for fun. That's good. And then I love Kevin mentioning stock market. I'll kind of touch on that too. Maybe there's a lot of games inside casinos, right, Joni? And so like you see so many card games, blackjack or slot machines or roulette, right? Yeah, those are great examples. So I'll share some, and our slides have animation, and you could always substitute some of these with some that are more common among the population you're working with. Many of y'all mentioned casino games. I don't know if anyone mentioned like animal fights, although illegal, still happens underground. Sports betting, which is very common. Sometimes people bet on races like horses or dogs, slot machines, and lottery. And I usually try to include some culturally specific games as well. So many of y'all mentioned mahjong, and then I don't know if someone mentioned bingo, and then we also include like the Southeast Asian games like gore, crab, shrimp. Like there are games with the dice on there, with the different animals on there, right? So a lot of these games. I'm so sorry. I'm gonna just close my door. When you call. So sorry. There are a lot of games that are very culturally specific. And so some of these are just to show that gambling could be so normalized within our communities that sometimes it's literally played from, like on Lunar New Year, during Thanksgiving, any family get together. Sakla, which is a game that's popular in the Philippines, is actually played after a funeral. And so the money raised is often given to the family of the deceased. And so it's literally play from birth to death, right? So I also include here some stats about older adults because I know sometimes, you all may work with people who may be older, and we know that older adults, gamble sometimes quite a lot, that they're one of the fastest growing age groups and also are, frequent visitors to Las Vegas. Among adults who are older, when they survey them, gambling is often one of the more common social activities. Can anyone tell me why that might be? Like, why do you think older adults might gamble more than other age groups? What might make gambling more appealing to them? They may be dealing with boredom, more free time, maybe less social connections, maybe using it as a way to boost retirement income. Sometimes it's the only activity that's accessible, right? If you think about it, like there's a lot of recreation that requires like physical activity or exertion. Slot machines, right? It used to be you just had to pull the slot machine. That's not too bad. But these days you could just press a button, right? Even easier. So sometimes it's also, yeah, maybe if you're on fixed income, you're like, maybe gambling could make me more wealthy and I could live more comfortably. Yeah. And so, I think a lot of times we know that older adults do find themselves having more free time on their hands. And sometimes they may have retirement income, so they have a source of money that they could use to entertain themselves. We also know that older adults who get addicted to gambling may be even greater risk for suicide, for example, because they might feel hopeless. They might feel like, how could I ever win all that money back? I'm not even working anymore, right? It's hard to recoup losses. So we usually also do a couple of myth busters. We could do these really quick to model them. So we usually make them as a fun activity to get people to think about what are some of the common misconceptions of gambling. What do you all think about this? In lottery, are there hot numbers that increase your chances of winning? What do you all think? Is this true, false? You could say myth or fact, or true or false. Do you think they're hot numbers that just boost your chances? So most of you say no. And is it because you're scared? I'm gonna ask you for your hot numbers, like you don't want to share. Is that why? So the real reason, of course, is that it's a myth. There are no hot numbers. All the numbers are room temperature, okay? No numbers that are hotter than others. Maybe other than sevens. Okay, maybe not. So some people might say, oh, I've seen statistics. Some numbers just statistically have been drawn more often. But does that mean that that number tries harder this week to jump out of the lottery machine? No, it doesn't, right? So every time you draw a lottery ticket, the chance resets. So just because a number was hot before doesn't mean it's going to be hot in the future, right? There are no such thing as hot numbers because lottery is random. What about this one? In the long run, the more regular you play in the casino, the more you'll lose. Do y'all think this is true or false? Like the more time you spend in the casino, you're gonna lose more than you win. Do y'all think this is true? False? I see some no, some yes, some trues. Okay. And then maybe, okay. So this one, technically, I know that some people say, like, well, you could get lucky, right? We're really talking about averages, right? Average. If you think about it, what are casinos? Are casinos like Asian Health Service? Are they nonprofit? Are they like NICOS nonprofit? Is their goal to make everyone healthy, wealthy, and rich? No, right? Their goal is to make money. That means, unfortunately, most players who go to casinos have to lose. That's how casinos make money, right? If you don't lose, they don't make money. If everyone gets rich, they lose money. They go bankrupt, right? And so those are some of the facts that we try to keep people, into thinking about that. Casinos also know. One of the things that we try to teach people is also like, we have to be smart consumers. If you do decide to gamble, you have to gamble smartly. If you do go to the casinos, you'll notice there are many ways they try to make you lose track of money, lose track of time. Can y'all share? You could go pay their PG&E. That's true. Their electric bills must be really high, right? Can y'all think of any ways they try to keep people there longer to make them lose track of time and lose track of money? No clocks, no windows, maybe mirrors. Sometimes I do see mirrors on the ceiling, right? Food. You don't have to leave to eat. That's true. Yes, very
Free
good.
rooms.
Free rooms. How do we know this? No, I'm just kidding.
Of
Yeah,
course,
they
they
do
want you to
have.
spend more money, so we're gonna give you, hotel's gonna give you a free night or two.
Yes, that's true. If you play regular enough, they might comp your room, right? What does that mean? That means you don't have to go home. You could stay up later and play longer. I see people say free play, the sounds, yes, the service. So y'all came up with a lot of great ones. So I'll share some on our animation. Free food or drinks. A lot of times it's alcoholic drinks because obviously we make better decisions when we're drunk. No, of course not. We also have no clocks or no windows. Why? When you could see the time change, when the outside, time is changing, the light changes, you're like, ooh, when I came in, it was bright. Now it's dark. I need to go home. They also make you trade in your cash for something abstract. Have y'all noticed that? When you play with poker chips instead of actual cash, it's harder to keep track. It also makes you more detached from the value, right? When you see actual hard-earned money coming out of your pocket, you're like, ooh, I'm spending too much. But when it's converted to a stack of plastic chips, you think, oh, that's just play money, right? Then you start to bet more, you lose more. And for example, game design. So like for example, they design casinos where all the slot machines make those sounds, right? Tina was mentioning the sounds. What sounds do you hear? All the ding 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 sounds, right? Do you realize that even when those slot machines, nobody is sitting at those slot machines. They're still making those sounds to trick people into thinking a lot of people are winning, right? A lot of people are lucky. I should test my luck. And then if you notice, casinos are really like a maze. If you notice that the carpets, they don't go straight, right? The walk path isn't straight. Why? They want you to walk by as many machines and as many tables as possible. And then all the exits look the same, so it's really hard to find your way so that you get lost and sit down and play more. And then last but not least, anyone has noticed this? Why the casinos have such colorful, crazy, hideous carpets? Any theories around this? They could afford any carpet. Why did they choose this? So, a couple of theories. One is that it hides the stains, right? People spill drinks or they drink too much, it comes back out. They hide the stains. But also, another theory is that it prevents people from looking down. They want you to focus on your eyes up, your eyes looking at tables on the slot machines, right? All of these things, if you next time go to the casino, you'll notice so many more things. It's not just these, right? Notice all the ways casinos tries to trick your mind into spending more time and more money. And then let's really quickly talk about how common gambling is. This is the map of California. Okay, so there's a lot of gambling in California. So the blue dots are tribal casinos. These are tribal casinos examples in California. Have y'all heard of some of these? Like Grayton, Thunder Valley, Cache Creek. And then the red dots are card clubs. These are card clubs like Lucky Chances, Oaks Card Club, Bay 101. So how will we get to one of these places if we don't drive, right? They're all so spread out throughout California. Have you noticed what are some ways people get to some of these places? If you don't have a car, they have shuttle buses, right? Have y'all seen those? Where do they pick people up?
At Walmart.
At Walmart. Very
I've seen the
specific. That's true.
supermarket parking lot.
That's true. I've seen them always pick people up at like shopping areas. And Chinatown, yes, Chinatown, Oakland, Broadway, or San Francisco Chinatown on Kearney, right? So we counted just in Oakland Chinatown alone, there are at least four different bus companies and bus shuttle services that run Monday through Sunday up to four times a day, right? So that's a lot. Very accessible, very convenient. In San Francisco Chinatown, there are even more, right? So they really target a lot of the neighborhoods where, like Justine mentioned, where older folks live. They go to the senior centers or senior home community. So sometimes it's very targeted, right? Yeah, no, you know. Yeah, don't look them up though. Well, you could go. You could go on the buses for research. Yes. We kidding aside, we do say that it is nice to try it out to see like a field trip so that you could see what clients or patients, experience when they're on the bus. We've done that once with our staff, so it was very eye-opening. And then we're not too far from Reno and Las Vegas also. So we actually did a study back in 2018 with the State Office of Problem Gambling. We went through all the stops in Bay Area, and then we had a partner in Southern California that did the same thing in LA area. So we wanted to find out who are these people taking the buses, right? And what are the reasons why they take the buses? So we found out that the majority of the people we survey at the gambling shuttle bus stops majority were women. They tend to be older. The average age was 57. So the range was very wide. Most of them were Asian Americans who also weren't born in the US. Majority of them spoke an English, a primary language other than English, born outside of the US. And the average household income for Bay Area and Los Angeles was very low, right? Around 44,000 for a whole household. And so these aren't people who had a lot of extra spending money to throw away at casinos, right? So that was kind of concerning for us. These aren't necessarily people who are super rich. And we also found out about 1 out of 5 of the bus takers that we survey could be addicted to gambling. That's really, really high, right? Almost 11%. We asked them, what are the reasons you ride the buses? Like what is motivating you? And you see a lot of these older immigrant folks were saying, it's because casinos are fun. We've had immigrant folks who tell us that they're so used to the nightlife in Asia, right? In Asia, things are open up until so late. Here, everything is closed by 9, 10, 11. What else is open at night? Casinos. Casinos are open 24/7. They have so many bright lights. It's exciting, right? And then a lot of people also use gambling as a way to meet new people to socialize. Someone also mentioned earlier that there's nothing else to do. This is the only thing. That's really sad. That tells me that a lot of our older immigrant folks don't feel like there's a lot of other good options for them for recreation. And then number 4, I highlighted because I think casinos do a good job of this, is that they make it so accessible. They have people who speak their language. They have foods that are culturally competent, right? That it makes people feel like that's where I could go to, feel like I belong, to feel like I could be surrounded by people who are from my similar ethnic group. I could speak my language and be comfortable, right? So casinos are really good at making that environment, like welcoming environment. Oops, sorry. And then let's see. So now I wanted to delve into what is problem gambling. Can anyone in the chat share when do you think gambling crosses the line? When does it stop being just for fun? Then how do you know it has become a problem? Like, is there a particular warning sign or red flag? Oh, I love that. Kevin mentioned play more than you can afford or have, right? Yeah, so like you start to have to borrow or you start to have to go to the ATM to withdraw more money. Virginia mentioned about borrowing from others. That's a huge red flag. That means you're gambling beyond your abilities. Yeah, those are all really good. Any others?
Going to the casino every week.
So Christine mentioned about frequency, maybe going more than you could afford to. Maybe you could afford financially, but you can't afford to spend that much time there. That could be a problem too. Thank you, Christine. Yeah. And then when it's all you want to do, I love that. So it's like you're losing interest in everything else. You're reprioritizing your life around gambling and it's affecting your daily activities. It's making it so that you can't fulfill your responsibilities or duties like job or school or relationships, right? Yeah. So these are some of the ones that counselors might use to diagnose someone with gambling related problems. So there's 9 of them. So I'll share some of these. They might have to gamble with more and more money over time to achieve the same excitement. So it's a little technical, but this is sometimes called tolerance, right? You build your tolerance. And so some people like if they drink too frequently, the same amount of alcohol doesn't do it for them. It doesn't give them a buzz anymore. They had to drink more alcohol to get the same buzz. So gambling, they have the same thing. Number two is that they have withdrawal symptoms. They're restless or irritable when they can't gamble. My stepfather, when he couldn't gamble, he would get so frustrated. He would just be in the bad mood. Number three, has difficulty controlling, stopping, or cutting down gambling. My stepfather would try to stop gambling several times because he knew that it was starting to be a problem, but he just couldn't stop, right? Because that gambling was just calling to him, and every time he just thinks, if I could just get lucky again, I could win all my money back. Let me go back and try to win my money back. Number four, thinking about gambling all the time. So you're constantly trying to think of like excuses, opportunities, and ways to gamble. And you're kind of like thinking through all the steps. Number five, using gambling as a way to cope with negative feelings or stress. So that's the only thing you want to do. Someone mentioned that, right? That's the only thing that gets you through the week or through the day. That's not a good thing. Number six, after losing money, going back to try to get even. I mentioned this to you about my stepfather in trying to chase his losses, he lost over 40,000 US dollars in Taiwan just in a span of months. Number seven, lying to people to cover up their gambling. So there's a lot of deception, a lot of lying. Number eight has jeopardized or lost relationships or opportunities. You all mentioned this. They're prioritizing gambling over everything else. Number nine, they're also relying on other people to help them out of desperate financial situations caused by gambling. Okay. So sorry again. I'm just open the door. Um, so if you know someone who has any one of those 9 signs, it means that gambling is already causing problems for them, right? Because you could tell one of these probably already means that gambling is affecting their mental health, their stress level, their relationships, or work and school. If you know someone who has 4 or more, that's the minimum a licensed therapist could diagnose them of having the gambling addiction. Okay. So 4 or more means that you probably should get professional help if possible, because it may already be something like an addiction. I'll really quickly run through this slide because you all focus a lot on health. I think it's really important. I think for many Asian communities, we tend to very much value our physical health because we know that health is wealth. And I think it's really important to highlight that gambling addiction and gambling in the casino environment often can lead to a lot of, health problems. We know that a lot of our gamblers, because of increased stress, When they win, they're so excited, but when they lose, they're like so stressed out that it leads to more things like headaches, maybe even insomnia. They're thinking about gambling all the time. They can't sleep, right? A lot of body tensions. Those ups and downs of gambling could also really impact other parts of your body, like your heart, your blood pressure, right? A lot of the lifelong gamblers that I know have very poor heart health. They have a lot of issues with like, you know, um, heart rhythm issues and other problems. And we also know that in the casino environment, people are consuming a lot of alcohol, right? There's a lot of secondhand smoke. So it affects other parts of our body too, like our liver, and so forth. And people also aren't taking care of themselves very well. People aren't eating right, they're skipping meals, or they're eating like very unhealthy foods inside casinos or different places. So, there's irritation to their digestive system. So people are having a lot of gastrointestinal issues. So these are common, okay? So I'm going to wrap up. The last part really is about teaching folks how to gamble more responsibly and safely. NICOS doesn't believe in abstinence only. We don't believe that, everyone needs to stop gambling or not gamble at all. We believe that a lot of people could gamble safely and responsibly. There's a small percentage of people who might be more likely to become addicted to gambling. Those people probably need to stay away from gambling their whole life. People like my stepdad probably can't ever touch gambling again unless he wants to become addicted again, right? But we also believe in education. So if our clients and patients decide to gamble, we want them to be ready with the right mindset, with the right tools, so that they don't lose everything. So we're going to teach people three concepts. One is randomness, one is independence of events, one is house advantage. I will go through each of those three slowly, okay? But let's do a quick activity to demonstrate the first concept, which is called randomness. So lottery tickets, usually we had to pick six winning numbers. If we already have 2, 10, and 18, can you all help me out here? Which of the following three numbers would give you the best chance of winning the jackpot? Do you think it's A, B, C, D, E? So you already have 2, 10, 18. Which one of these would be the best? So many of you mentioned about any of the above. I also have someone who prefers 27, 39, 44, right? So we talked about this really quickly in the beginning. How do they choose lottery numbers is random, right? So if lottery is really random, any of these combinations are possible. Can anyone tell me though why B might look better than the other options? Like 27, 39, 44 just naturally looks better, right? Can anyone tell me why? Why might it be better than 19, 20, 21, do you think? And so, like, yeah. So, like sometimes people are saying, like, well, it's in sequence, like Justine says, right? You're like, well, you already have number 18. Then if you have 19, 20, 21, that's all in sequence. That's not going to happen. But let me ask you this, right? In a truly randomized lottery draw, does it matter? It actually doesn't. Option A is just as likely as option B. Okay. Some people think like, oh, statistically, B is more likely because it looks more random. But in a truly randomized activity, all of these can be have the same chance. For example, I'll tell you why. Just because the number 18 ball has come out of the lottery machine, does the number 19 ball try harder to stay inside the machine? Does it know that it's number neighbors with number 18? It doesn't, right? Inanimate objects like the lottery balls, they don't know, they don't care, right? And so any of these combinations are possible. So when you choose lottery numbers, don't try to let lucky numbers fool you. It's okay. We always say it's okay if people want to use lucky numbers, but it becomes a problem when they overly invest in it. right? They think, oh, my numbers are lucky. I have a strategy. So I'm going to put more money than I could afford into lottery. That's a problem, right? That's a recipe for a problem. So that's the first concept we try to teach, which is randomness. That all gambling games have some elements of randomness, meaning there's no patterns or trends, okay? So there's nothing, no statistic that will help you in those activities, okay? Even in like if you're betting on sports or horse racing, people say, "Oh, there's statistics. I could read the past statistics," but it doesn't matter, right? What if the horse trips and falls? What if the the best player on the team gets injured, right? All of those things are random. Those are things that you cannot control in gambling, okay? The other concept we try to teach is independence of events. When the lottery is up to really high, people like to go to certain liquor stores. They like to go to the previous winning stores. Have you seen that? Some of the stores will have a big sign that says, "We've sold 2 winning tickets before." People wait in line for hours at those stores. But what we say is that those things are not related to one another, right? When you do gambling, each event is a new event. The past doesn't predict the future. Okay. Just because that liquor store has sold previous winning tickets doesn't mean that they're more likely to sell another one. All the stores have the same chance of selling a winning ticket. Okay. And so the don't try to use past statistics to predict the future. And then the last concept we try to teach people is called house advantage. Can y'all tell me who is the house? Who is the house when people say the house always wins? Who is the house? The casino, the host, right? The people running the gambling is the house. So remember that. Don't gamble to make money. Gamble if you can afford it, just for fun, because gambling is meant to, is not meant to make the players rich. It's meant to make the casino or the operators rich, right? So the only true tip I have for you if you want to get rich in gambling is all of you have to go open your own casino. Okay, that's the only guarantee way to make money. Maybe not guarantee, but that's a better way. All right, I'm gonna wrap up. So we talked about the 3 concepts that we want to teach you. If you do want to avoid gambling problems, remember randomness, independence of events, and house advantage, and teach other people. And if you do decide to gamble, set money limit, right? Don't bring more than you could afford. So always bring only what you're willing to part with. And set time limit because it's easy to lose track of time. Set alarms. Bring a friend who could always remind you that it's time to go. Leave credit card, debit cards at home. The only machine that pays 100% of the time is the ATM at the casino, right? But that's already your own money. So don't use the ATM. And don't borrow money to gamble. If you have to borrow money, it means you gamble more than you could afford. And have a plan. Win or lose. Know when to step away, know when to walk away, right? So those are all tips we want to leave people with. There's also a slide if you work with family members on how to protect their own financial futures. It's about keeping their financial accounts separate so that the person who has the gambling problem doesn't have access to the joint accounts, doesn't have the PIN numbers. You could also talk to your bank or credit card companies to set up alerts so that you know when there's spending alerts or issues. Don't co-sign loans. Don't let the gamblers borrow money. That's really hard in the Asian family, right? We think that to be a good family member, you help by giving them money, but that's not good for gamblers, right? When they think that my problems will be solved by my family members, they'll just pay all my debt, then they don't have to be accountable for their own behaviors. And then if you know someone who's a family member of problem gamblers, you should encourage them to get help also, so that they don't have to deal with the problem gambling or gambler by themselves. All right, so the very last part is how to get help. The easiest way to get help is to call 1-800-GAMBLER. That is a toll-free 24/7 hotline. They have counselors who speak English, Spanish, Cantonese, Mandarin, all other languages. They use interpreters, so nobody is turned away. Okay. So through 1-800-GAMBLER, you could get access to all of these services for free, including telephone counseling, in-person counseling, group counseling, even you could get tech support. You could get free self-help books in 20 different languages, and different kinds of referrals as well. Okay, all of these are free, paid for by casinos, by lottery. All the gambling places pay into this program. And that's the last slide. I do want to ask for your help to do a post test just for the facilitators. You don't have to ask your PLCs to do this when you do the training. So this is just for this workshop, so that you could give us feedback on what we could do better. I also want to take this time, though, to ask if you all have any questions or comments or, ideas of how you might present this information more effectively in your own communities. Would love to hear any thoughts. So would like to open it up. Vance, my colleague, also put the post test link in the chat, so you could just use that if you don't want to scan the QR code. And my email is also listed on the slide, so I'll put it in the chat also. Even though we did this training today, you don't have to just use this opportunity only. You could also reach out to me if you want additional support.